Is your health insurance coverage about to fundamentally change overnight? Robert F. Kennedy Jr. has just dropped a political bombshell by firing two of the most influential leaders on the panel responsible for determining which preventive medical services are required to be free for Americans. Before we continue, if you want to stay on top of everything happening in U.S. politics, hit that subscribe button right now and leave a like. It really helps this channel grow and ensures you get the updates that the mainstream media might be trying to downplay. The U.S. Preventive Services Task Force, or the USPSTF, is an independent panel of experts that holds immense power over your wallet and your wellness. Their recommendations effectively dictate what insurance companies are mandated to cover at zero cost to the patient. This includes things like cancer screenings, heart health monitoring, and various essential preventive tests. But on May 11th, that authority hit a massive roadblock. According to letters obtained by The Hill, Health Secretary Robert F. Kennedy Jr. made the executive decision to terminate Vice Chairs John Wong and ESA Davis. The move came after Kennedy personally conducted a review of the task force's recent operations and leadership structure. In his letters to the ousted officials, Kennedy was brief but firm, signaling that this was not merely an administrative reshuffling, but a deliberate change in direction for how our nation defines preventive care. Now, why does this matter to you? The USPSTF isn't just an advisory board, they are the gatekeepers. If they decide a test is essential, your insurance company has to pay for it. If they drop a recommendation, you might suddenly find yourself facing a bill for a procedure you previously thought was covered. By removing these two specific leaders, Kennedy is making a very clear statement. The era of the status quo in federal health policy is officially over. Critics of this move are already sounding the alarm, suggesting that the removal of top-tier medical experts creates a vacuum that could be filled by political appointees rather than objective scientists. They worry that if the leadership of the task force is based on alignment with the current administration's ideology rather than peer-reviewed data, the quality of healthcare guidelines in the United States could suffer. We could see a pivot away from established medical consensus toward the specific health priorities favored by the current Department of Health and Human Services. On the other hand, supporters of Kennedy's decision argue that the USPSTF has become a bloated, out-of-touch bureaucracy that has failed to adapt to modern medical needs. They point to delays in updating guidelines and a lack of transparency in how these recommendations are formulated as proof that fresh eyes were desperately needed. In this view, Kennedy isn't dismantling healthcare. He is cleaning house to ensure that the panel serves the interests of the American people, not the interests of a medical industrial complex that has dominated these conversations for decades. The ripple effects of this firing are likely to be felt in insurance boardrooms, medical schools, and doctors' offices across the country. If the leadership of the task force is changing, the priorities of the task force are almost certain to follow. We are talking about potential changes to guidelines on everything from mental health screenings to vaccination protocols and beyond. The question remains, who replaces them, and what will their mandate be? We are watching a significant power struggle play out in real time, one that will ultimately impact the cost and accessibility of medical care for millions of Americans. Is this the bold leadership needed to reform a broken system, or is it a dangerous gamble with public health? So what do you think about this? Is RFK Jr. doing exactly what he promised by shaking up the establishment, or is this a step too far into partisan territory? Drop your opinion in the comments below. I read every single one, and I want to hear where you stand on this development. The administration has clearly signaled that they are not afraid to use their authority to reshape the government's health apparatus from the inside out. As this story continues to develop, we will be here to break down the facts and analyze the consequences for you. Stay tuned, keep questioning, and keep watching. Thanks for joining us today.